Hello, I'm Eve Lyon, Recovery Navigator for CareerSource Research Coast. St. Lucie Recovery Works is a no-cost initiative supported by the U.S. Department of Labor, and it is a pilot project to provide resources and remedies for the opioid crisis, sadly, that we have experienced locally. My focus is to connect social service, treatment service providers, the judicial system, and law enforcement to the workforce development community. The mission of CareerSource Research Coast is to provide opportunities and improve lives. And so CareerSource provides resources for job seekers and employers. Job seekers can gain access to job readiness support, including resume preparation, interview tips, and job search strategy. For those who don't have recent or transferable work history or skills, CareerSource Research Coast also offers training and apprenticeship opportunities. Employers are assisted with hiring employees and training staff through a variety of programs. Today, I am blessed to have Lyle Fried with us, who has extensive experience in the recovery field. And we know that there are just so many sad statistics about this situation in our country, and most particularly in our local area. Today, I'm going to be asking Lyle a series of questions. He has a previous experience as the executive director of residential substance abuse treatment centers in Florida. He has assisted many in addiction treatment field to help improve professionalism and gain board certification. He's guided several organizations in the process to obtain licensure and accreditation. And he has so many alphabet acronyms after his name that I am going to let Lyle tell you a little bit more about his specific expertise. And then we'll get into a series of questions. At the end of the day, my goal is honestly to put some support systems out there in our community. I welcome employers to reach out to me if they have success stories to talk about in supporting people who are in recovery that they've employed, or even if they're struggling with somebody who's on their staff currently and is really a great employee and they want to continue to assist them in being able to become healthy and get treatment. So if somebody wants to reach out to me, you can reach me at Lyon, E-L-Y-O-N, at CareerSourceRC.com. I'm now going to let Lyle introduce himself, and then I will ask him a few questions.
My name is Lyle, and I've been working in the substance abuse and mental health field for about 20 years. I've done everything from scrubbing the toilets up to being an owner of facilities and everything in between. Had a lot of focus on the indigent in my early years, working in nonprofits and faith-based organizations, and then went on to be a therapist in some for-profit organizations, and from there moved my way around and up to where I am today, where I have a pretty large focus on first responders and veterans, but help anybody really who calls. My other areas that relate to it is just some published research on the genetics and amino acid therapies as it relates to different mental health and substance abuse issues.
So Lyle, you've told us about yourself and your current work, but specifically why what you do is important.
Oh, well, there's so many people that need this help, and unfortunately there's a stigma attached to it and a lot of misunderstandings as to what substance abuse and substance use disorders really is. A lot of people think it's just a matter of willpower, and that's what the research clearly shows otherwise, that there's other factors involved. Certainly some decisions are involved in the long run, but the fact of the matter is that these are people who need and deserve help.
So that actually was my next question is what do you think the biggest myth is in the recovery world?
I think one of the biggest myths is who suffers from this malady. We think of the person in a back alley, the person living under a bridge, but I can tell you in my years of working in the industry, I've served everybody from brain surgeons, judges, lawyers, airline pilots, you name it, just about every member of society, professional sports stars, Hollywood movie industry, and everybody in between. And again, the focus that I have now is largely on veterans and first responders for mental health and substance use issues. And people don't think of that, but they experience a lot of things in their daily work, post-traumatic stress and other things that can be self-medicated at times. And even if they're not, there's still an issue that needs to be dealt with.
It's interesting that you say that because, in fact, it's been reported that 1 in 3 Americans have a criminal record, which is 70 million people. A very high percentage, I think it's 83%, are related to substance misuse felonies. And so when we look around our community, that's pretty significant. So in thinking about your background and your past, what was your life-changing moment?
I had been working in fine arts and in graphic design, and it was an industry filled with a lot of substance use, pretty much cocktail hour and drug use was a part of that. And it seemed that it didn't affect me for a long time, but then the reality hit where it had overtaken my life. And when I finally basically got dropped to my knees and decided there was a need for change, it opened my eyes to a whole new world that I never knew existed.
Thank you for sharing that. I hear this over and over again as I'm out and about in the community and I talk with people. I hear about this side, the positive side, the new quality of life side that they celebrate every day. And I celebrate with them as I'm out and about and I'm visiting treatment facilities and social service agencies that are helping to support people in recovery. I constantly hear these phenomenal life-changing stories, and so I celebrate that with you. What are your future plans, and what impact do you think they'll have on the community?
Oh, goodness. Well, that's an ongoing question for myself, actually. So I continue to work for a group called Supportive Healthcare, which is part of the UpHealth group, and they have several treatment facilities, and I'm really liking some of the focus. We have a program called Help for Our Heroes and some other things. But I'm sort of gravitating more and more back to my roots in in Christian recovery. I'm currently finishing up my PhD in pastoral counseling. So probably something that utilizes that and allows me to help more people from my faith-based sort of centered approach to it.
So since we're talking about that, if somebody is listening to us right now and wanting to seek assistance, what would you recommend that they do?
It depends on what their needs are. I mean, there's so many different things out there. I mean, I'm always available. I have a general policy. I'll help anybody who calls me. No matter what their needs are, we'll find a solution. And I would say 99+% of those are people who call without any means. And so I've been working, like I say, a long time, and I have connections across the country that I can refer them to that are healthy options.
Well, that's kind of a can of worms that you're opening, but how would somebody reach you if they wanted to?
Well, my cell phone is pretty active. There is a certain time of night that I turn it off and leave it in another room for self-preservation.
Good for you.
Yeah. But you can call my cell phone is 772-332-8711. I'm pretty easy to find if you look around on the internet. I don't hide real well.
That's how I found you, actually, and I'm so grateful that I did. And again, I will put out my contact. That's Eve Lyon, ELYON, at careersourcerc.com. And I also am open to helping anybody, whether it be on the employment side or just on the personal needs side of trying to find assistance. And then do you think that 211 is also a good resource?
211 is an excellent resource, keeping in mind that it's localized. So the 211 in your area will give you resources in your area. Sometimes it's actually healthy to leave your area. And so I often recommend that people look at options. If there's too many influences close to home, that they consider maybe somewhere a little farther away.
I've heard that as well. So to reach 211, you dial 211 on your phone, or there is a direct line. It's 561-383-1112. I believe that they're there 24/7 to provide assistance, to be able to give you some direction. There's so much help available, whether you can have insurance or you don't have insurance. Don't make that be the issue. Just put it out there and get help. There are so many different types of programs. I know a lot of people know about 12-step programs, but there are many alternatives as well. There's something called the SMART program for those that are not comfortable with the 12-step. And so don't just, fear that it's not for me or I don't think that's what I can handle. There are resources. And
211 is good. And sorry to interrupt you. 211 is excellent because they do more than just the treatment services. They have so many social services and wraparound things that people are going to need. And maybe it's someone even like you work with people in early recovery. They're already through that stage, but there's so many other services they may need to know that exist in their community.
Absolutely. Housing, I know, is huge. I know that some people do come down here for treatment, and then when they're released, they struggle with finding a place to live. And so, yes, 211 can help with directions for that as well. Do you have any spare time? And if you do, what do you do in your spare time?
Spare time, not anymore, because with my spare time, we've started a local recovery church. And so that kind of fills up the Saturdays, basically.
Okay.
And we meet every Saturday at 4. And then I'm also run a charity, a 501c3. It's for a ministry in Haiti for orphans and widows. And then, of course, I need to save some time to spend with my wife.
Yeah. So if somebody wanted to attend your church, where is it and what time is it?
It's every Saturday at 4 o'clock. We meet at the Crossing Community Church at 5200 Oleander Avenue. 4 o'clock every Saturday. We're there.
And I know you're getting ready to go to Haiti, and I'd love to hear a little bit more about the project there.
Oh, okay. Well, we sort of found this place back in 2010 when we were there doing work with Rotary after the earthquake, and sort of fell in love with it and been going back ever since. My wife went back, I think, 5 or 6 times that year alone. And so since then, we've been able to build a school there, a new church building. We just are finishing now a new 2-story orphanage. And we have plans to put a medical center in this community. It's got 70,000 people with 0 medical care.
Amazing. Wow. That's terrific. And how many people are working with you in addition to you and your wife?
Working with us, well, on the ground in Haiti, we have 17 people there. Nobody here stateside gets paid anything. It's a group of volunteers, largely myself and my wife, and we've got some recent folks that have joined us from the recovery industry, oddly enough, and that's kind of a neat thing.
I think that's very admirable. People who have been helped want to give back, and so I think it's a natural inclination and drive, and so that is just very exciting.
And that kind of brings up one of the other, you talked about myths, and it is that people who are in recovery aren't good employees, and actually quite the opposite. Statistically speaking, they do more, they give more, they miss less work. Somebody who's working a recovery program actually is a better employee than the average person.
Well, and not only that, but it's great for them. Gainful employment is strongly linked to better recovery outcomes. So obtaining and maintaining employment helps people in recovery to establish a legal source of income, structure their time, improve their self-esteem, and also it reduces substance use and criminal activity. So I mean, there are just so many benefits to employment and working. And look, this is a population that's improving their lives. So everything that they're doing is to have that quality, and financial security is definitely something that we all want to strive to attain. So thanks for bringing that up. What is a call to action that would improve employment outcomes for people with substance use disorder?
Should be a part of anybody's recovery plan. As far as a call to action, I know that when I'm working with people, before they would leave the umbrella of care that I work with, they would be case managed to understand where you're going to live, what's your accountability, how are you going to support yourself, what are you doing, even if they didn't need an income. And I've worked with several people who didn't. They either had a retirement fund or they were just independently wealthy. We still recommend that they at least do volunteer work, because that is a self-esteem builder. Giving back is part of what makes you who you are and healthy.
Absolutely. I'm on my third career personally that evolved as a result of volunteering. So I'm a huge proponent for volunteerism. It seems that every time I get to a new community, I'm new to the Port St. Lucie community. I was in Palm Beach County 16 years, and I've been here 6 months. And so typically when I get to a new community, I go out and find a place to volunteer. And I was volunteering at a homeless services provider, actually in Martin County, and met some people from CareerSource, and so we say the rest is history, and that's how I landed the opportunity that I'm involved with right now. But it's throughout my life been a way that I can immerse myself back into the community, meet people, build a support system, build a social network. So I think that's terrific. So is there anything else that you have on your mind that you think is important that we should be talking about today?
I mean, there's so much related to work and recovery. There's a growing recovery community here in St. Lucie County. It's always been here. There's a lot of strong community supports in the form of, like you mentioned, the 12 steps. There's several faith-based organizations that support it. other community resources. But now, in the last 10 years or so, we've actually seen quite a few treatment providers pop up in the area, as well as recovery homes. I used to be chairman of the board for FAR, which is the Florida Association of Recovery Residences, and there's a credentialing or certification process for homes to be shown as living up to and working up to certain standards. So we're seeing more and more of that happening. There's some opening now as we speak.
I also hear often as I'm out in meetings, community-based meetings, that there's a great need for life experience peer support. And I'm working behind the scenes because I know that there's a challenge in getting peer mentors and peer support staff certified, because if they have life experience, in many cases, they also may have felony background. And then getting through the Florida credential system is a challenge.
Sure.
So I'm working with some people who are in partnership with the Department of Children and Families, and hopefully we can come up with solutions for that.
They have changed some of the requirements lately for people for certain certifications. So when you do that level 2 background check, it gets flagged automatically with anything, right? So they are starting to, for those specific certifications for peers and CRRA, which is a Certified Recovery Residence Administrator, it's at that peer accountability level. They've sort of loosened it some, and the exemption process has gotten a little better. I don't know that it's where it needs to be, but it has certainly gotten better.
Yes, I understand the process is that there's a pretty significant ability to explain your situation. And is it 3 years? Is that the magic timeline?
Yeah, so there's a lot of talk about that. I'm not sure of the exact magic timeline.
Yeah.
And because I hear people come to me with different cases asking me to help them get the exemption, and it doesn't seem to be a set in stone sort of standard.
All right. Well, we know that the employment needs in our local community are huge. Every time I'm at a job fair, I hear and I see billboards and signs everywhere I drive that there are job opportunities that are open, and so many of our employers are trying to hire people. And we just want to really put it out there that this is a population who is striving to improve their lives, that they are available for employment, and they are working on their own recovery, and they're doing it outside of work time. I know, Lyle, you've told me that there are so many meetings available and support systems available at many, many different hours of the day and times of the week that it shouldn't affect somebody's ability to maintain an employment schedule.
No, there's plenty of opportunities. There's day, evening, and even morning. There's noontime meetings. There's all kinds of things available. So it shouldn't. I think one of the biggest barriers, though, for people in early recovery is often transportation. And we're getting better at that in St. Lucie County, but it's not like you're in the big city where you can get anywhere by rail or bus.
Right, and that's a good point, because I think, the employers who are struggling to hire really want to take that into consideration, and perhaps they can assist with transportation or buddying up people that live in, close geographic proximity to each other to help with that as a solution. So let's put that out there and have people get creative and start to be solution focused rather than looking at what the barriers are.
Yeah, and I think some of the recovery homes play a role in that as well by providing a certain level of transportation to some of the resources that are available to their residents.
We've covered a lot of topics, and I still want to really drive the point home that this is about building bridges in the community. And so I put it out there again, Eve Lyon, ELYON at careersourcerc.com. If you're an employer and you're open to second chance employment and helping lift people up, please reach out to me. If you are somebody who's listening who has a family member who needs supports, or if you yourself need supports, please, seek assistance. We have to come together as a community, and we all have to support each other, and that's how we will address this crisis that's happening in our community. I heard a statistic that 92,000 Americans died of an overdose in 2020. That is something that we have got to work on. We have to come from every corner, whether it be the faith-based community, whether it be the social service side, whether it be the employment community, social media. Everybody really needs to come together to think about how we can address this issue, support this population, continue to lift them up, work to find remedies.
There's a group called the Treasure Coast Opioid Task Force.
Yes.
They do some of that peer training, there's some education and prevention, a lot of things. So it's a good group to get connected with as well.
We also have Drug-Free St. Lucie, which is part of the St. Lucie Roundtable. And they're working really hard to distribute information within the school system. I know they recently just, I think there was a Fort Pierce and also a Port St. Lucie a turn-in event where people could turn in anything that was inappropriate to have in their home, including, inappropriate substance and paraphernalia. So, there are efforts happening in our community. And again, we all just need to come together. So, I am a great researcher, and I'm always looking for information and statistics. And when we talk about second chance employment, there was a survey that was done recently by the Society of Human Resource Management, and they surveyed business owners, human resource professionals. And they asked them about hiring people who have had some kind of criminal background. And it was staggering that most of the employers, like 83% actually, said that they would hire and find that in many cases, this population is actually, they're better employees, I guess is the bottom line, is what I'm trying to get to. And so both business and human resource professionals supported that they absolutely found that workers with criminal records were comparable or of better quality than workers without criminal records. And this touched on factors including job retention, dependability, potential for promotion, job performance. And so we want to really think about, how can we help facilitate that? CareerSource does have some resources that are available that employers may not be aware of. They can assist with a federal bond, and that, God forbid something happens, that there is an insurance policy for the first certain period of time that the employee is working within the organization. They also have training. They have many, many, many training opportunities. So for people who are in recovery and can't or don't want to go back to their former field because it's not good or safe or healthy for them, there are many, many training opportunities. They have apprenticeship opportunities. They have on-the-job training. There are funds available when somebody's hired. If they are not 100% skilled up to the level that the employer may need, they're able to seek some financial support from CareerSource, and that helps with offsetting the wages during the training period for the individual. So really want to encourage those employers to be reaching out to CareerSource Research Coast and learn more. If you go to the website, it's careersourcerc.com, and you can learn more about those opportunities, or you can reach out to me, and that email is elyon, E-L-Y-O-N, at careersourcerc.com. So please, keep in mind all of those resources available at CareerSource, and be open-minded about second chance employment. We are maintaining a list right now of employers who have stepped up and said that they have so many success stories, and I'd love to hear some on some of my future shows. So if you're an employer out there and you're listening and you have a great story to tell, please reach out to me. And I'd love to have you, come share your experience and hopefully motivate other employers to be more open-minded. But if you haven't reached out to us, to put yourselves on the list as that, organization that's providing that second chance opportunity, please think about that. In my past life, before I got to St. Lucie County, in Palm Beach County, I did a lot of work in the reentry field. I worked for a nonprofit organization that provided resources for people who are homeless and coming out of incarceration. And so many success stories that I witnessed in just, providing that training that gives somebody another perspective on what their life can be like and how they can be a contributing member of their family, of society, of that employment opportunity. It's a beautiful thing to hear these stories. So please reach out to me if you have any to tell. And Lyle, thoughts on your side?
Sure. Another thought came to mind as you were saying that is that when they hire these people in early recovery, they're typically staying in a recovery residence, which has standard regular drug testing. So these are people that already have levels of accountability built into their life. They've got a sponsor or some sort of other mentor or someone discipling them, whatever program they're in. So these are people that are not without other supports and other eyes on them, so to speak. So accountability is always considered a big part of that early recovery stage. And so that's sort of it takes the burden off the employer of wondering all the time what's going on. They've got a resource in that recovery home that they can tap into that's actually doing some of their work for them.
It's so great that you said that, because when I talk to employers, I say that you hire somebody off the street and what you meet them one or two times in a job interview and you don't really know much about them. But when you hire somebody who's supported by a social service agency, a treatment facility, or a sober home, there's a team behind them. There's a team invested in their success. And so you are getting the benefit of a well-balanced employee who has this support system that comes with them, and spokespeople that, are their references and who are providing a healthy place for them to live. And as you mentioned earlier, even in some cases, transportation to get to that job. So absolutely. I have, through the assistance of Lyle, put together a list of local sober homes and treatment service providers, and so I can help with those resources as well if anybody is looking for information regarding that. Again, Eve Lyon, ELYON at careersourcerc.com. Lyle, I just want to thank you so much for your time today. You're so informative. I want to wish you huge success in your project in Haiti and your upcoming trip. And I hope that it's easy travels and everybody's healthy. And thanks so much for being my support system and my reference guy and all of the other great things that you do to help support the work that I'm doing. And thank you.
It's my pleasure. Thanks for having me.